Silent, do not disturb.
Then you have 60 minutes. It's the last one someone said. Yeah. Is it Zoom?
Zoom's here.
Because there's issues problems. Try and tell them, mate. But it doesn't go. I got to get rid of that.
That's fine. I can do it.
There we are.
He changed the
Yes, I got
that more documented any stage 2? No?
Before I forget, yeah.
Are you going to introduce me?
Good morning, everyone. Please take your seats. I'm Paul Torzillo. I'm one of the partners of Healthabitat, and I'm also privileged to be a board member of the Fred Hollows Foundation. Welcome to the launch of Housing for Health, the Guide. Brian Dulan is the CEO of the Fred Hollows Foundation, and I'll ask him to welcome us here and say a few words.
Well, thanks, Paul. And can I begin on behalf of all of us by acknowledging the traditional owners of this country, the Gadigal people of the Eora Nation, and recognising their elders past and present. Look, I guess there's three reasons that this is a really important occasion for the Fred Hollows Foundation. The first is, I think it was, Fred had an expression which was health hardware. And he used the term health hardware to refer to all those things that go into a community that support people living healthy lives. But Fred, health hardware was housing, it was water, it was sanitation, it was the infrastructure that allowed people to conduct their lives and live a healthy life, as I say. And that's very much what this study and what this guide has been about. The second reason is that when Fred was studying, when he was a young surgeon and studying in Wales, he went with a guy called Archie Cochrane, and they travelled into the mountains and valleys of Wales, conducting a survey around glaucoma and eye disease. And Archie actually had a saying. I always thought it was Fred who had the saying, but Gabby knows as well. It was Archie who had a saying, which was, no survey without service. And that's very much been the mantra in the development of the Housing for Health Guide. It hasn't been about just going and collecting data. It's been about going, yes, collecting the data, yes, having the evidence, but yes, taking action on behalf of the people and with the people that the survey was being conducted with. And the third reason is, and it's an application today. Now, today we are working towards the elimination of eye disease, and particularly one of those eye diseases is trachoma. Now, most of you will know that Australia is the only developed country in the world where trachoma is still a problem. Fortunately, we can say it is a rapidly declining problem. And what we know from the latest survey results is that less than 4% of some remote communities still have some levels of trachoma. We are certainly on the road and close to elimination, and that'll be a great day for this country when we can recognise that. But in other parts of the world, it is a huge problem. For instance, in the province of Oromia in Ethiopia, we're working with a population of 32 million people to eliminate trachoma. Now, the strategy is called the SAFE strategy. It's around SAFE, surgery, the delivery of antibiotics, face washing, and environmental change. And in truth, the surgery and the delivery of the antibiotics are the easier parts of that strategy. It's behaviour change around face washing, it's being able to get access to water to wash your face, and it's around environmental change, not having organic matter laying around the community, having good sanitation infrastructure so that you're not breeding flies passing on the disease, etc. So the model that Housing for Health is giving us is not a model about Australia. It's a model for international health. It's recognising health hardware in the communities where people are living, and it's giving us a model that we can use in Eritrea, in Ethiopia, in Kenya, as well as here in Australia. So I would just like to congratulate the guys on to Steffi, to Paul in particular, and to the team that's worked on this on behalf of the Fred Hollows Foundation. Not only congratulations, but thank you. Cheers.
Thanks, Brian. I'm going to ask Lillon Bandler, Dr. Lillon Bandler, from the University of Sydney Medical School, who's had a profound influence on the teaching of Aboriginal health in that school, and has been the most important advance there since Peter Moody and Charles Kerr, who went there 40 years ago. So as you can see, she's a bit of a new benchmark, and we're privileged today to have her make a few comments. Lillon.
Thank you. As Paul says, I'm Lillon Bandler, and I'd just like to start by echoing the words of Brian, acknowledging that we stand on Aboriginal land. It's sometimes easy to forget that when we're surrounded by cameras and lights and very high-tech equipment. but just take a moment to reflect on that. And I'm, as Paul said, a senior lecturer, and my curriculum area is Indigenous health, and I've been asked to say a few words relating housing to health. And this is actually a picture of my father. For those of you not from Tasmania, you won't know, but this is actually taken in the late 40s, early 50s. And I just wanted to recognise his role in my understanding of the social determinants of health. My father was a refugee, and I say that in the context of Australian politics, where we're very keen these days to vilify refugees. But he came from Austria via London, where he left his much younger stepbrother in an orphanage, and came out to work here in Australia. And he brought very little with him other than a typewriter, for reasons that are beyond me, some carbon tablets to treat diarrheal disease, which I thought was extremely, showed real forethought, and his mind and his education. And he was a civil engineer, and his passion was for water. He was in Tasmania to work on the hydroelectric scheme down there. He then came up to Sydney and started work for what was then known as the Metropolitan Water, Sewerage and Drainage Board. I learned to say that when I was very young. It's now known as Sydney Water. Doesn't have quite the same ring. But his passion was water. And it was really from him, and not my medical school, that I came to understand that water and sanitation are really the great advances in health. And that access to potable water, the removal of wastewater, these are fundamental to international improvements in health across the centuries. And these are not new concepts. I spent the last 2 days in a health conference on global health and improving health across the globe. But these are old things that we've been talking about for a long time. So you'll see, if I can work this green pointer, that this is actually a quote from 1942, talking about housing and talking that we don't necessarily need to see really hard data here, but we do need to improve housing in order to improve health. And this work that is done through this program that we're talking about today really reflects the work that's looked at housing in poorer parts of Britain, in poorer parts of the USA, and that looks at waste and waste disposal and access to good water in developing countries, and recognises that there is clear evidence on a daily basis that these things will improve health. And so it is across the world. With a very simple phrase, we'd like to change the environment that makes people sick. Yami Lester, who was involved with Nataba Health in the mid-80s, really started this project and the movement towards actually putting into practice what is very basic knowledge. So in the mid-80s, people were looking at what is it that's in the environment that makes people sick, and in particular that makes Aboriginal people sick. What is it that we need so that we don't have that sickness? What is it that will change those parameters and those key end outcomes that will actually make a difference? So let us have a look at what's there, but keeping in mind what, as I also attributed it, I should say, to Fred Hollows, but let's keep in mind that there's no survey without a fix. So let's have a look at what's there, they said, and let's fix it while we're there. And what illnesses might we improve when we do so? And we know clearly that improved water access will reduce child mortality. Improved removal of wastewater will reduce diarrheal disease for under 5s. We know that face washing in children reduces rates of trachoma. These are really self-evident things that we don't need to do a lot of work on anymore in terms of proving them. But we do need to do some work in order to deliver them. When we look at housing conditions like this, it's reasonably easy for us to say this will not deliver the sort of health outcomes that we would like to see. When we start looking at houses, we have to think more clearly about it, and we have to think in a different way about it. So they started with survey fix number 1, 120 houses, is that right? As I recall, and they tested 240 items. And they fixed some of them straight away, so if there's a light bulb that's not working, you can replace that light bulb. And now they boast, it has to be said, They both they've done 188 survey fixes. That they've looked at just under 7,500 houses and probably improved the conditions for around 45,000 people. I think they're guessing about the 45,000 people, but it's still impressive. And now they're thinking not only about Australia, which you can see they've looked across Australia, but now they've moved into looking at New York City and parts of New York City and looking in Nepal. And what do they find when they do their survey? And this is a reasonably consistent finding for all of those places in Australia and overseas. They find that 10% of houses are electrically safe, 35% or about a third have a working shower, and about 6% have a working kitchen. And with the average cost per house of 7,500, which is a really small number in our sort of society, they can make a big difference. It's also worth mentioning that they also look, when they look at those conditions, they also look at why are those things not working. And it's important to here take the moment to actually kill off a myth. And the myth is that Aboriginal housing is bad because Aboriginal people trash their houses. In fact, what they found was that 70% of those non-working things were because routine maintenance had not been carried out. And 21% had been always like that. So from the moment that those houses were built, they had problems. Things were put in incorrectly, things were put in upside down, they never worked. And a very small percentage, 9%, were related not just to damage, and to abuse, but also to overuse. So if you have a lot of people working and living in a house that's been built to accommodate 4 and you're accommodating a much larger number, then you put much greater strain on the infrastructure in that house. And with their first survey and with subsequent surveys, they've been able to do this. So they've got to the point where 75%, 3/4 of the houses are electrically safe. 84% have a working shower and 18% have a working kitchen where you're able to prepare nutritious food and store it. And that's at an average cost per house of 7,500. And I emphasise that again, we're not talking about high cost here. We're talking about delivery that is enormously available and can be funded reasonably easily. And what does that mean for health? Well, thanks to New South Wales Health, and I have to confess, I don't often thank New South Wales Health, but I would like to take the opportunity to do so today. They looked at 10 years of housing for health in New South Wales. Their cost of housing was a little bit higher, but what they found was that there was 40% reduction in hospital separations. Hospital separations are not the perfect indicator for looking at as a disease marker, but they are a useful surrogate, particularly for Aboriginal and Torres Strait Islanders. And most of it was related to environmental health-related disease, particularly acute respiratory, gut, skin, eye, ear infections. I should add, and this is your slide, Paul, I take no, it's so animated I can't believe it, but I should note that it is in part two that this Housing for Health actually also looks at research and development projects, really trying to find the best things that will actually make this process go well. What's the best tap that we can use? What's the best thing that we can put in a shower? So what is Housing for Health and why are we so enthusiastic about it? And this is my understanding of it. I've taken time to go through their website and I recommend the website to you. I've taken time to look at the guide and I've never built a house. I say that having acknowledged though that my father did build a house, so I do have some understanding of how to hold a hammer. But what it is a coordinated, consistent and documented approach to the assessment and repair of housing to ensure a high standard of health hardware that will contribute significantly to the improvement of a community and its health. And for that reason alone, it's worth taking it, thinking about it. And what is the Housing for Health Guide that we're here to talk about today? Well, it's a really complicated one. And taking Paul's example, I've animated this for you. This took me a really long time. But what's in there are some really basic principles, some fundamental principles about safety, about electrical, gas, fire and structural safety, about some fundamental key end outcomes that we need to see happen in order to improve health, about washing people, about reducing dust, about reducing trauma, about removing waste safely, and then looking at community and what needs to happen in a community. So if we look and we just take one small picture, which is up in that little corner here, and we just think about washing children. We know that washing children aged 0 to 5 years reduces skin, ear, eye, diarrheal infections, reduces diarrheal disease, and reduces acute respiratory infections. And most importantly, we know that by doing that, we're not only improving the life of those 0 to 5-year-old children, but those infections are important markers for adult disease as well. We know that by doing that and improving the conditions for those children, we also improve outcomes for adults, because those diseases in childhood are important markers and important predictors for adult disease as well. So who should use the Housing for Health Guide? And look, I've taken this from their website, and I challenge anybody in that room not to be listed on this page. If you are, could you see me at the end, and I'm sure I can find a way to fit you in. So most of us should have a look at this guide. It's a very useful document, and I recommend it to you, because it documents the really hard work that needs to go in, the sometimes dirty work, the sometimes grinding work, the sometimes really unrewarding work, or apparently unrewarding work that needs to go in to improving health by improving housing. And it's about improving health hardware, it's about improving health and thus reducing poverty. And why do it? Because we think that these things are really important. We think that improving people's health is important. We think that we can do that by improving safety. We think that improving nutrition is important. And it reduces the list of problems that Aboriginal people here in Australia and other poor people around the world need to address on a daily basis. So if you no longer have to walk out of your house thinking about the fact that the toilet is blocked or that the shower doesn't work, it's one less thing off your list of tasks for today, and it allows you to actually think about what are the other things in your life. Importantly too, there is the opportunity for people to actually improve skills, and in the longer term hopefully to have employment opportunities. Because each one of those skill survey fixes have been associated with the employment and the upskilling of Aboriginal people. And about 78% of the people working in each of those survey fixes have actually been Indigenous or Aboriginal people. There's clearly work still to be done. There's never work is never finished. And clearly we would like it so that you never need to use this guide again, because we do eliminate the inequities in housing that are a reflection of the inequities of populations across the world. However, I'd like to take this opportunity to congratulate all the people who have worked on this project. I think it is magnificent. I'm proud to have been asked to participate today, and I thank you for that opportunity to actually be involved in something that improves health and that actually starts to address some aspects of world poverty. I'd like to now hand over to Paul again, who will introduce Dr. Swan.
Thanks, Lillon. Just before I do that, in 2012, Paul Folleros and I went to Alaska and met a lot of people there working in health and in housing. And we talked at a place where in the winter it's 40 degrees below zero. We talked to people from communities who can't go outside for 3 months of the year and everything's frozen over. And we thought, you couldn't be any place more different. In fact, what those people were worried about was how were they going to keep themselves and their families clean, how were they going to have a sustainable water supply, how were they going to get water that was hot, how were they going to control the temperature, how were they going to get food, store it, cook it, prepare it. They had exactly the same issues and concerns as we had here. The detail of how they addressed those issues was different, but the principles were the same. It fitted with stuff that started with Sandra Mahuba's and then Paul working with people in Nepal, looking at sanitation, toilets in a particular village. And again, we found different environment, different fixes, but a very similar set of concerns about healthy living in a sustainable way. We think it's clear to us from this, we've learnt this has got international implications. There are two groups globally that we're now working with and are interested in partnering with us, and I'd just like to give you a brief video clip from those two. The first is the Building and Social Housing Foundation of the UK, who are involved in awarding the World Habitat Award to Healthabitat. And the second is Archive Global New York, another group concerned with housing and health with very similar objectives. And we're just going to hear briefly from those two organisations.
Building Social Housing Foundation is an independent housing research organisation based in the UK, but we work internationally. We both undertake research ourselves, but also one of the main aspects of our work is to identify good practice in housing in other organisations or other countries. One of the ways that we do this is through the World Habitat Awards, which we coordinate each year in partnership with UN Habitat. And the following year, we then organise study visits or peer exchanges to the award-winning projects so that people who go along can learn about the good practice in those projects, can perhaps develop working relationships with others, or look at how they can transfer that knowledge or practice to their own organisation, their own country, or their own context. At the moment, we're undertaking some research in the UK around housing and health. We're identifying good practice, in particular around aspects of health and safety within the home. Another part of our work with regard to housing and health is identifying good practice as part of the World Habitat Awards and sharing that practice within other contexts. Healthabitat's Housing for Health programme was a World Habitat Awards winner in 2011, recognising its significant achievement in improving the housing and health conditions for people within Australia. We also, following on from that award, organised a roundtable event within the UK in London and invited representatives of Healthabitat to attend and also to transfer their knowledge and practice to the UK context. The other aspect of the work, where we've had a contact with the organisation on its work, is that as part of the programme of them winning the World Habitat Awards, we arranged with them a week-long study visit or peer exchange to Nepal to the village sanitation programme. This was so that practitioners from other countries could develop collaborations and could also learn about Healthabitat's work within Australia. It was a very successful programme, and following on from that, we're working with Healthabitat to produce an interactive report. This will contain information both about the study visit in Nepal, but also about Healthabitat's work within Australia, and we'll be making that available on our website, the BSHF website, also through our networks, and we're hoping that this will help extend the good practice that Healthabitat have identified to a range of other organisations and contexts throughout the world. We believe that the guide is really relevant to our work at BSHF because we believe that the content within it is very relevant to a world context, and obviously that fits with our international remit. So we're very keen to work with Healthabitat to extend the reach of the guide through our networks and through further collaboration, because we think that it's a very important tool which can be used for knowledge transfer and exchange.
Architecture for Health in Vulnerable Environments, based in New York. We're also just looking through archiving for the work has been since 2007 set out to prioritize use of housing, particularly housing design as a key strategy for improving health. And the way in which we sought to do that since 2007 is to prioritize this through a twofold approach. One which is preventative, so that is improving housing to prevent spread of disease, and the second is what we call a treatment-based approach, which is addressing or improving living conditions for those who are already severely ill. Our work tends to, or has been, prioritizing infectious disease. That is, we focus on improving living conditions for those vulnerable who are also at risk of specific infectious diseases. These diseases so far included tuberculosis, diseases like malaria, and diarrhea diseases. That's something that we believe we will continue in the near future, and we believe has been largely informed by the work of Healthabitat. Through the work that they have, it's well documented, through the work that they've been doing over the last 30 years, we have seen firsthand, and the impact has proven, the results that can be achieved by improving poor living conditions among the vulnerable and the likely improved health outcomes that result. It's based on this premise that Archive and organizations like Healthabitat and like Archive will continue to advance, or we hope anyway, will continue to advance this dual approach, improving living conditions while at the same time improving health outcomes. The guide highlights the role, or certainly the impact that can be achieved through improving housing, using specific targeted strategies and health outcomes that can be achieved. And in much the same way, those are the principles that guide our organization. We recognize that there are other approaches towards that can alleviate health burdens globally. However, we try to focus on the home, individuals, occupants, and the risks that they particularly face. The taxonomy of approaches, the range of approaches that exist in terms of linking living conditions to health, have been, we believe anyway, it's been well documented. However, there is still space as we continue to address the dual burden of health risks that communities face, as well as the issues around poor living conditions, whether or not that's overcrowded environments or whether or not those are environments that lack suitable ventilation. We believe these risks need to be further documented and exposed and shared. And for that reason, we certainly hope that an organization like Archive Global can contribute in some way to some of the work that's been published through that.
Thanks, Helena. We're really privileged today to have Norman Swan here to formally launch this guide. We're privileged because not only is it a household word in medicine, but he's someone who has a reputation in health, a bigger domain than just medicine. And the second reason is that his name is really synonymous with two things, evidence and data. And they're things that have been major drivers in the work that we've been involved in and the development of this guide. So it's a great privilege to have Dr. Norman Swan here today.
Thanks, Paul, Lillon, and I too acknowledge that we are meeting on Aboriginal land and pay respects to elders past and present. What more powerful and shameful example or evidence of dispossession could there be than housing and lack of it, or the fact that this nation is so disdainful of the first inhabitants of Australia that they build crap housing. 1 in 5 of those houses that have been looked at, and it's just a small sample of the total housing stock, are lousy houses. So we throw people into housing that's not fit for habitation, that's going to go on fire, that floods, that's unhygienic, unsafe. And of course we have a conversation in Australia about Indigenous people, Aboriginal and Torres Strait Islanders, which is full of prejudice, hidden prejudice which we don't admit. So it's about dirt, it's about neglect,
it's their fault. And it's not about the system. It's not about what we provide. This organisation has been excluded from the Northern Territory build of housing. Why? Maybe because they're building crap houses too. We don't know, because there are no data and no examination of this. Housing is one of the core determinants of health and well-being and development. And Paul is kind of, he over-flattered me, but he's certainly right that health is far more than just medicine. And health is far more than every single person in this room knows, better than me, is far more than just the traditional determinants of health, the things that people think about: cholesterol, smoking, exercise, your diet. Everybody in this room is interested in the truly upstream causes of ill health and so on. Yesterday, I just come from Melbourne, where I'm co-director of the Festival of Ideas. And last night's session, which is worth looking actually on Festival of Ideas website, was about human rights, and it was a lot about Indigenous health and well-being. And Marcia Langton was talking about data of the most highly granular form to actually chart and measure progress in development of Aboriginal and Torres Strait Islander communities, and how we run away from transparent data which really tell us whether or not we're moving forward. Education is one of the most potent determinants of health and well-being, life expectancy. To give an example of tuberculosis, just how potent this is. To give an example of tuberculosis, there used to be this huge, it's always been a huge route in curative medicine and the public health people. Which is more important? And of course, the public health people say, what we do is important. And doctors say, the medical side say, well, it's what we do in terms of the drugs and all that crap. And so, tuberculosis was a good example. So many of you know this story. So after the war, they noticed that tuberculosis rates were declining. They said, this is due to streptomycin, all these wonderful new drugs we've got. This is why tuberculosis is declining. And the public health people said, no, you're wrong. If you actually look at the data, tuberculosis has been declining steadily since the end of the 19th century, and you can't even see a blip. You wouldn't be able to tell which streptomycin was introduced. And that's because of what we did in the late 19th century: health, hygiene, sewage, all that stuff in the mainstream community. And a historian at the Australian National University working with a German sociologist said, look, you're both wrong. We can show you parishes in Europe, Barry Smith, parishes in Europe side by side, just as poor nutrition, just as poor housing, but one's doing better than the other in the early to mid-19th century, before they had the social hygiene movement. So what was the determinant? The determinant was that villages and parishes that taught women to read and write had less disease, lived longer, and had less consumption. Female literacy is one of the most potent determinants of health, as is education in general, and housing is right up there with this. We have to have a new conversation which acknowledges dispossession, which acknowledges that we need to measure and hold ourselves to progress. We need a new conversation which is about community control, which moves beyond community-controlled organisations. Community-controlled organisations have left non-Indigenous Australia far behind. They know. So you've got health reform going on at the moment. Everybody's talking about consumer engagement. They haven't got a bloody clue how to do it. Aboriginal organisations do. They've been doing it for years, decades, just around the corner in Redfern, first place to do it. So, in terms of interaction with the non-Indigenous community, we have to actually have a meaningful conversation about control. And of course, one of the things that these housing projects that go through in terms of Healthabitat's Housing for Health is that an essential building block, to use an unfortunate metaphor, but an essential building block of this is in fact that communities themselves are skilled to actually take some control of their own housing and their own circumstances, and given some opportunity to actually be able to maintain their own homes in what are often remote or difficult to get to locations. And of course, once there's housing, a lot else can happen. And those other ramifications of having secure, stable housing that's clean, that's better maintained, and is safe, means that there's other things you can get on with in life, and that you can live your lives according to how you want to live. We all live our lives the way we want to live. People without housing can't. Whether you're somebody who's got schizophrenia and lacks housing, somebody who is seriously disadvantaged in a city and is homeless, and people in Aboriginal communities where the authorities think they've done the right thing and there are houses, but look, they make a mess of it themselves. They don't make a mess of it themselves. The mess is made by the authorities who put the housing in the first place. They wouldn't do it in non-Aboriginal communities. This is important work. I know that people are listening to this and watching this from overseas, and the guide has got these 9 principles which are applicable anywhere. But what I'm interested in is the country in which I live and of which I'm a citizen, Australia. We've got to get this right. And I'm sure this guide will help. I congratulate Steffi, the 2 Pauls, and all those others who worked on this. Lillon for holding the banner high and the flame keeps burning. And to you all who are working either in this area directly or indirectly. It gives me great pleasure to launch this guide.
Norman, this won't be the flashiest present you've ever received. And you won't be able to put it on your wall, but it's a set of various didactic material about the work, evaluation, etc. And we give it to you with great thanks for your time. Okay. The last thing on my running sheet is to ask Paul Falleros to come and navigate the guide, and there are dozens of people in this room who put in years of massive work into housing for health projects, the development of the guide, and today I'll specifically mention Helena, who has been working as a Trojan architect, IT genius and great person. And there are many other people here who've gone back years. I don't think anyone would deny me the minor moment of saying that none of this would have happened without PP, the driving force right from the get-go. Steffi and I were lucky enough to hitch ourselves to his star some years ago, and I've had a great time since. Paul, come and show us through the guide.
Thanks, mate. Look, if we launch a book, I never give up until I've opened the cover and seen at least one person read one paragraph. So this is electronic, so I'm going to force you to do it now, if ever so briefly. And Lillon, you've done a much better talk than I've ever given, so we've captured that. Up the top, it's a working document, safety, and we'll just quickly go to safety. And again, we've looked at, and in the field we call this things that will kill you today we need to fix first. So these are serious things, electrocution, explosion, injury from fire, etc. We go back up to health and housing. There are the 9 healthy living practices, and we're just going to look at one. We'll go into, let's just take a look at showers. And I guess this is the level of detail that this guide is about. The first part of every section, and there's many, many sections about showers, in this case, gives you, if you like, the problem. Why are we even interested in this? It links to health in an important way. In the right-hand corner, you'll see the number that should cause us concern. In Australia, 35% of the 7,800 houses we've walked into have a working shower. If that's not a national disgrace, I'm not sure what is. We can then
get into that data and not just say it's 35% of showers, but we can actually look at which bits of the shower don't function. Now, if you're a designer, an architect, industrial designer, this is the stuff that should give you cause for thought. Am I putting in taps that will fail? Am I putting in the very best equipment to give the family a chance of it working? That's something to dwell on. We move on. We go back up and let's just look at, we give some real world examples and let's just pick one. So we try and give a graphic picture of what the problem might look like and what we see when we're walking into houses. This is a case where aggressive water in the Northern Territory has eaten out the copper pipes put in by an inexperienced designer. The water eats the copper. Within 3 months, the water's coming out of the wall as well as the shower. The system fails, demolish the wall, rebuild the entire system. This can be avoided by using the right materials in the right place. So that's an example. So we give people examples of what their mistakes might look like. Moving down, our main job is to get things right. So we have what we consider in each section ensures. Things we believe from work in the field, research, all our work, we think you have to do these things. If you don't, you will get a failure. So for young designers, experienced designers, look at the list and get it right. We keep going. We also have some things that we think at least you should consider. They mightn't be mandatory, they mightn't be as firmly fixed, but they're things that you should at least run your thoughts around as you're designing the building. And we give some examples of what the solutions. Now this is a case where a family painstakingly took a nail punch and punched out every hole in the shower rose so they'd get a decent shower. It was the cheapest shower rose put in poor water quality, which clogs the rose within a couple of weeks. And this is the antidote, the family taking action. We can fix it by putting in a much better shower rose at the start. So all of this so the kid gets a wash. We've got a section on quality control. We can make a list out of this so that as you're designing, as you're constructing buildings, you've got a list to check, is the shower going to work when this building is finished? And on maintenance, our main job is to keep buildings working for the long haul, not just when they're finished, but for the long haul. This is the sort of things you have to check in showers to make sure that shower is going to deliver service to the young child. And finally, standards and references. If you really want to dig more deeply into this subject, we've got lots of places you can go to get even more information. And if you want, you can then download what you've seen above, or you can print the page and slowly assemble in your office a hard copy version if you're old and need hard copy, not electronic stuff. We'll go back up. Healthy communities very quickly. We won't go through, but these are then the bigger things that wrap around a community, like the water supply, the energy supply, the waste system, all the things that plug into houses that make the houses work pretty obviously. And there's a section very similar on each of those. So we'll keep going. Let's go to news feeds, Helena. We'll just go to the second, the house. And we've got in the guide, we're going to be putting up news feeds that will constantly be changing. And we thought for today, it's pretty important, and Brian Dulan kicking off said it much better than I will, but we tried to bed people in why do we need a guide? Well, we need a guide because 30% of showers work, 10% of houses are electrically safe in 2013 in what is now per capita the richest country on earth. Why is that the case? Well, part of that, we're technically not doing a good enough job, and that's our job, and we can improve it. So this is a brief story about why we need to use the guide and build better houses. Okay, we'll leap out of that. It's interesting that two of the speakers have touched on this, and again, I thought it was important to put up our guides. Healthabitat's had some very, very important and influential guides. Yummy Lester, already talked about, Stop People Getting Sick was his catch cry that started all this work in the mid-80s. Fred Hollows, who I was lucky enough to meet briefly in the beginning of this work, and Paul Torzillo knows much better. Inspirational organisation, and Fred had the line, no survey without service. You've heard it today, and that really started our work. You don't go and look at a problem without having the means to fix it on the first day you're there. And someone who hasn't been mentioned today is a good old mate, and sadly we lost this year, Colin James, who lived nearby and worked nearby as an architect, and he had a great expression, make housing a verb. He thought that houses had to do something for the well-being of people, and I'm sure if Col was here today, I'm sure he'd support the guide as he has had in the past, and I think he would say the guide is a way that you need to show that houses have to perform for people. That's our guide. So we'll go back to home page, and just quickly we're going to look at toolbox. And I'm not going to dwell on this. In the toolbox we have, as it suggests, place for the people who are going to work with a guide to actually use it to do things. We've got the ability to, in design and specification, we can spit out a list of all the things you need to check on your drawings for architects. For quality control, we have a list that you would check when you go to your drawings or to your site, so you have a list in front of you that you can tick off and make sure you're getting it right. We'll look briefly at maintenance, this ongoing issue of keeping things working, where you can select the time period you think is relevant to your organisation. So let's say 12 months, what jobs should the electrician be looking at every 12 months, and we can filter that and give you a list of prioritised, all the electrical items that we think an electrician should be checking every 12 months. Away we go. So you get the idea. Back to Toolbox quickly, and we've got, this is the first time that we've got products and processes. We've got add or edit an item in the guide, which is the first time this, we believe, is interactive, not just in Australia, but from anywhere. If you see a section in the guide you think is incorrect or can be improved, if you want to add an image of a failure or a success, if you want to add a new section, there's actually a part you can go to, make the changes you desire, send them to us, we'll have a team editing them, and that way we hope the guide, this is a shell we're putting up today, we hope within 10 years this will be the central point people will come to get medical help, advice about the link between health and housing, and then to look at what solutions can they use. We've got products and processes which link you to things that have either been designed, developed, or we've selected that work better than others, so you can get directly to better shower roses, taps, cooking equipment. We've got the ability to export any of the data you've seen in brief snaps today. You can get that to your office, you can use it, you can think about it as it sits on your desk. And many Indigenous communities we've worked with have local teams who can work and do work. 78% of our staff nationally have been local people from the communities we work in. This gives you a list of all the maintenance items that they can legally do throughout their community, again, on a scheduled basis if you want. So if you're running community teams out somewhere in the paddock, this is a list of safety and health related items to keep the houses working. Go back up to home. Just down the bottom, and I won't go through these, but really the big underpinning, and Paul Torzillo always undersells his position in all of this, in that this work is about health, it's come from health, and it will remain centred on health. He originally came up after a lot of work with these 9 healthy living practices. He's almost re-engineered in the guide where they came from. He's gone back and done a much more detailed outline, which I won't go through, of all the different chapters about where they've come from, why they're important, and he's given an extensive reference list, and we're hoping this will appeal as much to medical doctors and public health doctors, so they can actually see this is where the problem comes from, and then these are ways you can go about solving those problems. So there's a lot of that. We'll go back to home, I think, just back down the bottom again in home. Sorry. About the data we won't touch. Who should use the guide we won't touch, but these are things that you can obviously go and have a look at. And finally, how to use the guide, which you'll get a much bigger rundown than I'll give you in this very short space of time. If we just go to about, I'm going to end by just thanking, there's a whole team of people, as Paul said, who've been involved in this, and I'm certainly not going to go through them all. They are listed here. The people who aren't listed, and it's a grab bag, there's literally thousands of Indigenous people now over the last, just since 1999, who've worked on housing for health projects. They've been from around Australia. With those people, we've had extremely skilled managers and team leaders and tradespeople who've all worked together to improve houses. Without those teams, we wouldn't have got the data. The first use of the data is to fix the house. We can then use it again to improve houses and future housing designs. They're also around, we've now done almost 8,000 houses, 199 projects. So I'm going to Lillon. We're really bragging here, not at all. And tomorrow it'll be a few more. But there's been about, and we capture how many people in each house in terms of data, around 50,000 people. Without those families allowing us into the house, giving us access to the house and working with us in most cases, then we simply, again, wouldn't have had any of the content of the guide. And that's critical. That's where the guide comes from. Families, Indigenous people around Australia. We've had advice on the guide from our lawyer, Kerry Bennett. Believe it or not, we need lawyers involved in this. Karen, who runs the Healthabitat office and keeps the whole show going. There were many, we'll scroll up here a bit, there was many on a review team who I won't go through, who met for 2 days at their own cost to use from all over Australia. They came to Sydney to put in all their years of expertise to look at the content of the guide. In terms of the people today, the launch, I've got to thank Brian, Hollows, Norman, Lillon, Paul T obviously, and we've had Simon Forbes who's doing all the filming. There's a brand new ring in, and BSHF in the UK, and an archive of course in the US who've done their little videos. They became film stars. The key people, I think, who've done just a massive amount of work. This has been a 2-year project just to assemble. Helena, who's here, who does everything. Jared, who's built, masterminded the website and the way it links to the content and the way we want to do things, which has been an enormous job, Jared Langdon. Greg Norman is one of our tireless managers who's been a research and development person. He's worked in the field doing the Housing for Health work, but he's also put a massive amount of work into the production of this guide, working with the team of Catherine and Jed. I'm not sure whether they're here. Younger people who've really jumped in and done just a lot of the slog behind what you see up on the screen. Justine Hill, who I've known for far too long, and she's worked far too hard, and she's here somewhere. Justine has been the person behind assembling the data, 4.2 million data points, assembling that data to somehow get it into the shape you see here. Dave Donald was important in getting together the review information, so when that review team sat, they had a whole swag of things to consider. Jeff Barker, who's again a tireless manager, has come across from Perth and made probably the most detailed comments about how we could improve the guide, and most of those, I hope, Jeff, have been incorporated towards what we've got now. And obviously Dr. Paul, who actually put in a lot of additional effort onto that health story that we just skip through in 30 seconds, but you can go into and look at it in detail. Steph, Paul, without them, there wouldn't be any Healthabitat. Thank you all. And to Brian, if you've got 1 second, and Hollows Foundation, not really just to you, mate, because you're we wanted to thank you. You get a big one. Wow. And if you rip those off, there's something underneath. Thanks, mate. Thanks very much.
I'm also going to mention that Bob Diel's quietly somewhere at the back here, the chairman of the board of the Hollows, and Gabby Hollows has come today with various members of the family, as is usually the case. And that's a great circle of closure for us, given lots of this stuff was discussed with Fred very early. If anyone's got any questions, follow us, be happy to answer. Yes.
Question for Paul. I believe there's an existing National Indigenous Housing Guide. How can you explain, when obviously there must be lots of differences, could you tell us how this guide differs to the National Indigenous Housing Guide?
There is a National Indigenous Housing Guide. It's in its third edition. It was launched in 1999, the first edition. I know that because we wrote it. It was accepted after being rejected by all states, first edition. By the third edition, all states of Australia and the federal government endorsed it as the rule book, if you like, for Indigenous housing. One small problem, no one actually followed it. In 2009, it was due for review. It should have been reviewed for the fourth edition. The then federal government, not only did not review it, they said they didn't really want to review it. By 2011, we realised that it was never going to be reviewed, and by now, 2013, we're pretty sure not only will it not be reviewed, it will be dismantled. So early last year, we made the decision that in the face of that, there was really no alternative but to basically launch our own. So we've taken a lot of content But this is a radically different document, it's fair to say. There's, in terms of how it works, in terms of what's in it. The last edition of the Indigenous Housing Guide was based on 3,500 houses worth of data, our data from around Australia. This is over 7,700 houses inform the information and the content of the guide. Now that's a huge difference. It's double the amount of houses that have changed it. So we think it's a radically different document, endorsed by no one at the minute, endorsed by no government.
I'd like to ask Paul, what's the status of the 7,000 houses in terms of how many more are going to be surveyed in Australia to keep this data up to date? So obviously New South Wales is still proceeding. What about the other states?
Yeah, the optimistic side, New South Wales government have continued, and a lot of the team that initiate that work are in the room today. That's very positive, and in fact it's expanding in New South Wales. There's been a lot of work done in New South Wales, which I think is really important. Our national program was shut down in 2011 by the federal government. They thought the work revealed far too many hard truths, so the simple way was to stop the program. So on July 1st, 2011, we sacked almost 900 people nationally, most of whom were Aboriginal people. So nationally, we now have a new government since that event, so we're not sure at the minute what the status is of Housing for Health, how it will be viewed nationally. What I do know is, while ever the problems like we know exist in houses continue to exist, then this work will be needed, or a variant of this work. We're not really particularly concerned if we do the work, but the problem exists, the work is needed. So we're just hoping that someone will either build a lot better houses or start to repair existing houses to a standard where people can use them. That's the status at the minute.
Kerry.
Thanks, Paul. Congratulations. I've just got a little bit of a silly Gabby anecdote, and my daughter Emma's going to scream at me for saying this, but I just happened to cruise past the eye clinic at Prince of Wales Hospital this morning. I had Emma with me. I said, Em, come and have a look, and I was interested to know what the project was like they'd put of Fred, and the foundation has donated a lot of money to redeveloping and renewing Fred's old clinic. And as I happened to turn up there, and Sister Liao, one of the sisters who was a charge sister from the ward, bumped into us, and we said, quick, let's get a photo. And as we did that, the maintenance guy was outside the eye clinic with his workbench, with a vice and a drill and the tools of the trade, and I just thought it is such a crazy coincidence. I still think Fred's around looking at us and reading the shame that we had from our Minister for Schooling, Education on the front of the Australian in the last day or so, front page about the bad, horrible maintenance of our schools, where our Aboriginal kids are going to school in the country is atrocious. And I think it's, health hardware but school hardware, and it's all about education. So it all kind of came together to me in my brain. But I've got this lovely photo of Fred with this drill and a vice and the work trolley from the maintenance guy at Prince of Wales Hospital. I thought that was just so crazy that I did that. And Penny, I hope you picked up my tab, have you, for my shower? No one knows the joke about that, but anyway, thank you so much. And congratulations, and I just hope that it is worldwide work that you're doing, you guys, and I really think Fred certainly is watching what you guys are up to. It's great.
Thanks, Jeff.
Look, I think we'll close. There are a few people who've got some iPads who'll be walking around. If people are interested in coming up and doing a bit more navigating, we'll have a few people who can do that while people are circulating, talking, indulging in whatever's at the back of the room. I want to thank everybody for coming. I want to thank all of the Hollows team who've put a lot of effort into making this work, negotiating, people coming indoors, food, arrangements, IT, etc. We're very grateful for it. Thank you for coming. Please stay around and chat.
Got a sign.